Welcome. Today we're talking about males in nursing matter. Today, the purpose of our presentation is just to increase your awareness of the value of males in nursing. We know that only 9% of nurses are males. And today we're going to talk to Ivan Sankey, who is a male nurse who graduated from Valencia Community College in 1985 in the field of nursing. Today, what we want you to take away is that male nurses add value to the profession. We also want you to hear how they contribute to the profession and why we need to recruit more male nurses in the profession. Welcome, Ivan.
Thank you. Welcome. Thank you for asking me to uh, talk to you today about something that I'm very passionate about, and that is the field of nursing,
Great.
especially as it relates to males.
Yes. So tell me a little bit about yourself, Ivan.
So I was born in Orlando, Florida, come from a family of uh, six, two brothers and three sisters. Our parents are from Alabama and Mississippi, but they ended up in Florida. Um, my whole family, for the most part, has been involved in healthcare all of my life. My mother is the one that basically uh, set us all up to be in the healthcare field because as we got old enough to get jobs, she would direct us to certain individuals which she knew. Um, and I'm married with Teresa over 37 years. I have a son and a daughter, adults, and proud grandfather of several children. I call them my quiver full. Uh, so, and nursing has helped us to have a very good life as a family. Um, I even our family we have several nurses. You, Jennifer, you have your doctorate in nursing, and you've been very important in my life. It's influenced me in the nursing professions in growth and development.
So tell me, Ivan, how did you choose the field of nursing?
I think the field of nursing chooses you. I don't think
Okay.
you choose it because my original study in college was psychology and sociology.
Mhm.
And in one of my classes, the professor said, well, for those of you who are thinking about sociology, psychology, plan to spend 8 years in school, and the job market may not be as good after spending that much time.
Mhm.
And this was in the beginning, so they give you a realistic view of the job market. So the reason I chose psychology and sociology is I like people.
Mhm.
I like thinking about things, why things act the way they act. Well, nursing gave me all of those.
Okay.
I didn't realize it at the time, but like I said, I didn't choose nursing. It chose me. So let me kind of give you an overview of my transition from where I was as a young man who was, let's just say, didn't know what direction I was going to take.
Mhm.
Came back from college after a year and a half and signed up. Well, I worked as an orderly in the operating room. That's where I started. As I was working, there was a technician that was I knew very well, had grown up with, that says, "You're going to be an orderly all your life." I said, "Oh no, I'm not going to be doing this long. I'm going to be moving on." Um, and I didn't mean in the medical profession either. I was thinking of something different. So anyway, he got me convinced that maybe looking into the surge tech program would help me, you know, um, learn a few things about what he was doing. And it was fun. It became a game to me because I would memorize things and make things easier. I'd make a game out of work, if that makes sense to anybody. So, anyway, I was a technician for over 13 years.
Okay.
And in that time frame, I got married to Teresa, and we hadn't started a family yet. But I knew that in order to help my family, I would have to get a vocation that could do that. Plus, my passion was for the operating room. So I wanted to do something that would allow me to stay in there.
Mhm.
So the next obvious choice would have been a PA or a operating room nurse. And so operating nurse is what I chose to do. And I've been doing that for a long time, but I still enjoy it. So once I got into nursing school, my wife Teresa helped me get through that because, there's a lot of study that goes into nursing. And at that time, I was still working full time, taking call, doing whatever I could to make sure my family was okay. And I then would come home, try to study. I'd be falling asleep. She'd be reading it to me. So that's why I always tell her that the degree is hers as well,
Yes.
because she helped me get through it.
You do need that family support when you go through nursing because it's a new, it's art, like an art, a science, like you said,
Yes.
that it
Yes.
really requires you to be able to understand how to put into practice what you read in the books.
That's correct.
So
That's
what I'm hearing you saying is that kind of nursing chose you because you had a passion and a love for people. And
right.
by being in that operating room setting, it kind of molded your thinking to see what else you could do with that
Right.
passion, particularly
Mhm.
since you didn't want to be in school for 8 years or 9 years and then come out and
Right.
possibly not be able to find a job that would provide the support that you need or the job security that you would need
That's
to raise
correct.
your family. There
Right.
is research that shows that most male nurses, they go into the technical field.
That's
They
correct.
go into different
Yeah.
specialties. They go into leadership. They don't
Right.
necessarily always stay at the bedside. So what you just described actually just kind of aligns exactly with what the research says is that male nurses, they are needed because they do have that technical skill. I love that you said that you kind of make a game out of it. You kind of,
Yes. Yes.
you learned, you memorized, you
Mhm.
anticipated what the doctors wanted, you
Right.
know.
Right.
And I think, if I were to kind of recap a little bit, you were saying that your mother or our mother worked into the healthcare field and that being surrounded around that environment, that influence at an early age was maybe
Yes.
one of the things that may have planted in your seed that gift of caring. So tell me a little bit more. You've done a lot. So you've done search tech, you've been an
Yes.
RN, but I know you've also been in leadership as well.
Correct. I actually I well, as far as I've done a few things, yes.
Mhm.
And sometimes I have to stop and think about what I've done,
Yes.
because it just seems like one thing flowed from the next to the next. Um, I had an opportunity to be a instructor for surgical techs,
Yes, yes.
and I was able to do a pilot program for Orange County.
Okay.
The program ran for about 2 years, and most of the students were either doctor's office employees, such as podiatrists or dental assistants. And my purpose was to teach them how to scrub, how to function in the operating room when they came to the operating room. And I love that part of it because I like teaching what I know.
Mhm.
So had fun with that and worked with that. And they decided, though, as far as a program, the students, I started out with about 30. We only ended up with about eight.
Mhm.
So in education, what happens is your funding comes from numbers. And if you can't sustain numbers, then you can't keep it up. And so for me, I was glad for the opportunity because it showed me that, there still was value, even though the numbers weren't as large as they wanted. Those individuals were able to gain a valuable experience to be in the operating. Okay.
And
Um,
yeah, I think you're a great teacher, Ivan. I mean, I actually have to reflect and remember that the first time that I scrubbed in the outpatient surgery setting, you were my teacher. You actually
mhm.
taught me the instruments, and I will always remember that you helped me set up. And as the doctor was asking for the instrument, you would just point to it and I would hand the instrument. So it looked like I knew what I was doing, but it
You
was
knew,
simply
you knew
because
what you
of
were doing.
the nonverbal cues that you were giving
Right.
to help
Hmm.
prepare me. So yeah, I do remember when you did that doctor's office training with those students at the hospital. And I think that added value because many times they would come in from those offices and didn't know how to. So
Right.
again, you being in that role as I think, being in the role of a scrub tech and then progressing to the role of a registered nurse in the operating room
Hmm.
really shows how God has led and guided your profession. So tell
Yeah.
me more about what do you like about being a nurse?
The adventure.
Okay.
One thing about nursing and most medical professions, but especially nursing, Um, there's a lot of adventure. There's never a dull moment,
Mhm.
uh, but there's stability in that adventure, if you know what I'm saying. You work every day. You do what you love. And sometimes you do things you don't love, but you do them. But it gives you a certain measure of stability, not only in your work life, but in your family life.
Mhm.
The tools that you gain in nursing, you bring to your family, or vice versa. You could either way. It helps you to, first of all, you look at medical field as a family of people who have a common goal. Common goal is to take care of patients. The common goal is to be fulfilled in what you do. And so for me, the adventure is I always learn something different.
Yes.
Even as I move from teaching the students, um, I left a secure environment of an organization that I worked for many years, because at that time in my nursing, I was still growing
Yes.
and I needed to be in an environment that I could grow better. So it actually was a smaller environment. It was an independent organization, but I had a whole lot of autonomy. I had a chance to become a certified nurse of the operating room at that time. And I did that for many years, as long as I stayed with that organization.
Mhm.
I got a chance to be able to do leadership,
Yes.
charge nurse. I was an evening charge nurse. And before I left that organization, I had an opportunity to be responsible for not only the operating room, but also the endoscopy,
Mhm.
recovery room, and central services. And so I had the support of my leadership. I made decisions. I was supported in those
Mhm.
decisions. I'm not saying I didn't get to places where I didn't know what to do, but one thing I did know is I did trust God. So I would
Yes.
pray first and talk to my leadership, after I talked to God.
Yes.
And a lot of things happened well. There were a few things that we wish would have turned out differently, but as it may be, I believe that was God's call to me to now depend on Him uh, about all the decisions I make, and I continually do that.
So, males in nursing really do matter because what you've just described is how God led you from being a scrub tech to being an educator
Mhm,
to being a registered nurse
mhm.
to leadership of three
Correct.
departments to be over the operating room, endoscopy, and central service. So it's really a pathway that people can choose. So I like that you said that someone said, are you going to be an orderly? And an orderly is someone who cleans the rooms, mops, wipes down after
Mhm,
the
mhm,
surgeries.
mhm.
It really took someone asking you the question, is this what you want to do all your life? And
Right.
you knew that the answer was no, but then you
Correct.
took progressive steps towards where
Mhm.
you really wanted to be. And what I heard you say is that it has helped you not only provide financially for your family, but also the skills that you've learned, the caring, the nurturing that you've learned as a
Mhm.
nurse, or that you maybe not necessarily learned, it was part of you, it's part of your DNA,
Right.
was transferred into the workplace, and you
Mhm.
were able to use some of the same skills in your home. So it's like a win-win, right?
Sure.
So you've
Sure. Sure.
actually, you've actually benefited many ways. So
Mhm.
tell me, as a male, what are some of the challenges that you encounter as a nurse?
Well, let me back up a little bit. Now, the
Okay.
takeaway from what starting out as an orderly,
Hmm.
there's no disregard for orderlies. Trust me,
Right.
that
That's true.
there's value. There is
Yes.
value. So I don't want people to think, oh, you're too good to be an orderly. I needed more.
Yes.
So in order to need more, I had to do more.
Yes.
And so I, I, I got options that came available to me. I took advantage of them.
Yes.
Um, Sometimes we can wait too long and not take advantage of things,
Yes.
but God in His own time, guided and directed me. And I know this is about male nursing, but it is also about God using me as a role model
Yes.
uh, for other males.
Hmm.
I have a lot of male friends who are nurse anesthetists, operating room nurses. There are some that are on the floor, but I have quite a few who work in special care. Special care requires you to understand machines and buttons and reading them and getting the right information to take care of patients. That's what we as male nurses like. For
Mhm.
us, it has to be interesting. It has to be competitive, if for lack of a better term. Males, some of the challenges we faced, what I faced when I started out so many years ago was I was the only male on a floor, so they considered me the orderly. Uh,
Mhm.
I had to learn that here's how we trade off.
Mhm.
I will help you move your patient if you would help me with this female patient. I, rather than, oh, there's, you can move big patients. And it had to be a team effort. So that challenge was, and sometimes we weren't given the respect, I want to say, that we deserve. And a lot of times, most of the nurses had a lot more experience than we had.
Mhm.
So the leverage, and anybody who's worked in a nursing environment understands the pecking order. The pecking order says the older nurses rule the roost and the young chickadees come along and you observe, so and don't get me wrong, I had a lot of good examples, a lot of good leaders and instructors, and some of them were pretty tough. But I figured in my mind, I said, this is something I believe I'm investing in.
Mhm.
I'm gonna do whatever it takes to get through this, and that's what I did. So that's some of the challenges that I faced as a male nurse.
Well, I actually like that you talked about how there were trade-offs. So I'll help you move your patient, but we do know that male nurses, one of the biggest challenges is taking care of female patients, especially doing
That's
that
correct.
Foley care or those
Absolutely.
things that you have to do, that care that, you don't mind doing it because you know that's your job as a nurse, but the
That's correct.
patient may have
Hmm.
some discomfort.
Hmm.
And so it's nice that you had that collaboration with your peers to say, will you go take care of this female patient, do these items for me? And so that way you worked as a team to still
Right.
care for the patient and care for them well. And I think that's really important what I'm hearing you saying. But Ivan, you mentioned that you were the only male on your floor. And so talk to me a little bit about generational nursing, because I mean, there's different generations of people
Mhm,
in nursing. So there's the boomers, the Xers,
mhm,
the millennials. Tell me a little bit about
mhm,
that and tell me, just kind of give me
mhm.
paint a picture for me how the
Okay,
male fits in those different
okay,
generations, the male
okay,
nurse.
okay. So, so boomers typically like to hear that they've done a good job.
Okay.
And that's the generation I was in. And it wasn't even about the money.
Mhm.
It wasn't about the position. You did a good job and you're getting paid to do a good job. And thank you.
Mm.
And we were okay with that. The younger generations, however, the Xers, they needed something different. They needed a lot more recognition
Mm.
and a lot more perks. They good nurses, don't get me wrong, but their motivations are different. They're not better or worse. They're just different. So they wanted, give me the money, give me the position. I deserve this.
Yes.
The millennials, I'm noticing these young men, they're not going to stay anywhere too long. They're on fast forward. They, I'm going to get this nursing degree to get me what I want in society. I'm going to use nursing as a means to an end, if that makes sense to you. I, that wasn't really my goal. My goal was a profession that gave me a sense of worth, a
Mhm.
profession that allowed me to take care of my family. Um, you know, so those are the kind of things that motivated me. But I can see clearly now that it has changed somewhat. And as you realize, their generation is more, how should I say, there are more of them than less of us. That's what I'm saying.
Okay.
And
Okay.
so now nursing is taking on a whole different perspective of how they manage things. And the one thing I will realize is this: males are brought to nursing the ability to make more money.
Okay.
You see, whereas the scenario back when I was starting out was the nurse typically was married to a doctor or
Mm.
a lawyer.
Mm.
Her salary, it didn't depend on her salary.
Mhm.
It depended on her husband's taking care of the family.
Yes.
But they knew that they could make a very good living in nursing. And also the other piece that I learned that I'm sure they figured out, being with those patients very close up, interacting with them, giving them a part of themselves, seeing them get well, go through rehab or whatever, and get well and move on was fulfilling, and that played into the nature of nurture. And so when males got into nursing, they were the one bringing home the bacon, and they didn't just say thanks for the 50 cents raise. They were saying, no, I have a family, and I need to be compensated, and in order for this to help me to help you all, it would help if the lifestyle was one that showed promise. So for us coming in, they were a little slow to accept that idea, but it came around. It has come around. Nursing provides a very good living, and I just kind of want to inject that's the main thing, that with males, you know, being able to um, hold their head up high and say, I am a nurse. I am a male nurse. At times back in the day, it seemed like males were in nursing were not as masculine as males in emergency medicine, paramedics. So the comparison was, oh, you're just a nurse. Well, that's not it, because now our reputation of being reliable, dependable, honest leaders has sort of outlived that stigma.
Okay. Yes. So there have been stereotypes, as you mentioned, with male nurses previously, but now it is actually really well respected that
Yes, it
males
is.
choose nursing.
Mhm.
I appreciate that you're bringing forward that, because males are in nursing, that it has made a difference in the salary ranges
Yeah.
that nurses are eligible for, because now without and increasingly males are getting into nursing, and I think it has to be an attractive field. The
Mhm.
whistles, the bells, like you said, the adventure, the tools. I know in surgery, when you see a saw, it's really a saw, or if you see
Right.
a mallet, it's really a hammer, or if you see
Hmm.
screws and plates, it's really that.
Hmm.
And so it's almost
Hmm.
like a carpentry field.
That's right.
And
Hmm.
so, and then if you work in ICU, you do have the ventilators and the more technical things that you need to be able to manage. And I think, like you said, it's just putting all the pieces together. How do I use these tools to better care for my patient? And
Hmm.
males do that well. Many times you just have to
Right.
bring them in, because they have that saying that how they say men and women think differently. You know,
Right. Right.
and
Right.
so
Right.
again, bringing the male into that equation or into the profession has actually made a positive difference, and it has added value for the
Hmm.
individual, for
Hmm.
the patient, and for our community. Even in society, it has added value, because males in nursing really do matter. So,
Hmm.
my question would be, I know you have nephews, someone's getting ready to graduate from high school, one is in middle school. Sometimes we can't recruit our own family because they think, what you do, I don't want to do. But there
Hmm.
may be some young men out there who are indecisive about what they want to do
Hmm.
as, for their career. You have actually highlighted a lot of benefits of being in the nursing field. But what else
Hmm.
would you say if someone was kind of indecisive, if you were to, try to recruit, if you will, or plant a seed, if you will, what would it be that you would say to them, as far as why would me or you as a male, I'm not a male, but why
Hmm.
would a male choose nursing?
Hmm. Well, for me, I think when you talk about family members that don't really, I don't think we talk about it enough, if you
Okay.
know what I mean. I think we as nursing professionals talk about it among ourselves, but the conversation is not so much with our nieces and nephews, sons and daughters. They all they know is dad goes to work, he pays the bills, but past that is no real encouragement early on. I think in our family for sure, we talked about things, but they didn't see the excitement that we saw.
Mhm.
We just lived it. So I think one of the things I would say to a male that wants to consider nursing, if you want a job that's gonna give you stability,
Mhm.
going to give you self-worth, going to give you the kind of money that you're capable of earning. Even if you're an LPN,
Mhm.
and I'm not saying that as a negative, I'm saying males can start as LPNs, they can transition to RN, um, and don't discount CNAs. They're
Mhm.
nursing assistants, but that's where I started at that level. So when you're a male, and even if you're in a long-term care facility, you can start out as a CNA. Understand, you could be that charge nurse in the nursing home. You can become an LPN. You can become the RN, because that's a pathway to success. So when I talk about education, you get the more education, it's endless, it's open. It's very a good choice to start somewhere. Let's say that. Let's say start somewhere. And believe me, you will not be disappointed where it takes you. Um, there are a lot of opportunities, many opportunities, especially, excuse me, the more education you get. There's so many options that you can do. You can teach, you can lead, you can follow, you can do anything you want. Um, and if you don't succeed, you have no one to blame but yourself.
Mhm.
So that's one of the things, and there's a great shortage. There's a great need for nurses, but a really great need for great nurses,
Yes.
because um, there are people who will check into a job to get a check. There are other of us who check into a job to take care of people and get paid for doing it.
Yeah.
It's a little bit different. So I would encourage that. And nursing is ever learning, ever learning, never stagnant. The opportunities for growth and development are great. Male nurses, one thing I think in recruiting males to nursing would be this: understand how the male mind works.
Mhm.
If you'll notice in sports, they're teams.
Mhm.
Men like to be a part of something, a team. And that's why I love it in the operating room when we're getting ready to do a surgery. Our team makes it, you can tell when it's clicking, and so males like that team. They have pride, or it shouldn't be pride, but it is what's the word I want to use? Yeah, pride. I got to use that. They have pride in being a part of a winning team. And even if they're on a losing team, they don't leave the team. They
Yeah.
stay with the team.
That's
So
right.
they have to have that sense of team. So politics, they have their viewpoint. Men are opinionated, as you know. So, you have to, in order to gauge them, you have to tickle them where they laugh. And those are the kind of things. Um, so in a general sense of where I'm losing my words right now, but basically engage them wherever it takes to get their attention.
And
And so that's
I
pretty
think
much.
you described that really well, Ivan. I think, really one thing there's several things you said. I'm going to recap. You said we need to talk about nursing more
Hmm.
outside of our own group. So,
That's correct.
in the operating room, on the nursing unit, we made, camaraderie, we love the family feel, but we need to
Hmm.
talk about it more among our family, among our friends, so that they will understand what we do. What they see is the outcome. They may see
Right.
what we've acquired, but they don't know how we acquired that. Or
That's
they may
correct.
not know the passion and the love that we have for what we've acquired, or that what we
Hmm.
do as a career. So first we need to talk about it. And then the next person, the person needs to know what they have a passion for. What is their fit? What do they enjoy doing?
Right.
Because nursing is not for everyone, and we know that. And there's some people who have chosen nursing because of the salary,
Hmm.
and it shows through the care they provide. So
Right.
again, choose something that's a good match for your personality, and then pursue
Hmm.
that passion. And then lastly, really find a mentor. Find someone who can help you succeed in what you are doing. I will always remember that first day I scrubbed with you. I will always remember when you walked me through your departments of surgery, endoscopy, and central service. Shortly after that, then I began to pursue and want to do more with my career. So
Mhm.
again, everyone needs a mentor or a support system to help them on first base, second base, third
Mhm.
base, and then to make a
Okay.
home run and
Mhm.
actually, pursue their dream, pursue their goals, achieve them. And everyone needs someone to walk them through the process. No one makes it on the first base
No,
even by themselves or
no,
second
that's
base.
correct.
So I like the concept you said about team. And I'll mention this too. I remember as I was contemplating whether to go into the operating room, you said you take care of one patient at a time. And
That's
I
right.
will forever remember that because for me, that was important to be able to give the nurturing and the care to that one patient
Mhm.
versus trying to give it to many patients. And some people can balance things very well
Right.
and it works well for them. But
Mhm.
I had recognized early in my career that I needed more of a focused
Mhm.
approach to caring for patients and caring for people. And so
Mhm.
I think that sometimes we just have to help navigate people to what's the best fit and specialty for them. And I
Mhm.
think you've actually articulated that very well. So, I think, I would say to our audience, talk more about nursing, talk about the
Mhm.
joys of nursing, you
Absolutely.
know,
Mhm.
and the fulfillment and how it gives you that, that self-worth that you have actually contributed to from sickness of a patient to the health of a patient by the
Correct.
nurturing and the care that you provided along their journey. And then when they're discharged from the hospital, you feel like you've actually contributed to that healing process. So I think
Mhm.
that's really important too. So Ivan, what motivates you to stay in nursing? What's been your
So,
motivator? I mean, because you've been in nursing since 1989, and that's a long time. So tell
mhm.
me, what's really if you would say the one or two things, what has really motivated you? You've kind of shared it throughout our conversation, but tell me
Mhm.
what's really been the really true core motivator.
My love of people.
The love of people.
Um, it goes back to psychology and sociology.
Yes.
So I did get paid for uh, sociology and psychology in that I got to talk to people. There are times when you'll see a patient who has challenges outside of their health care
Yes.
that you can talk to them and you can give counsel because we see a lot of things a lot of times over. It's not just a one-time wonder. Everything we see has happened several times before. So when you come across a situation, and even with your coworkers, you can give advice, sound counsel based on your past experience. So what keeps motivating me in nursing is that I'm involved, I'm engaged. It's my passion.
Yeah.
It's helped me a lot. I mean, even as I think about male nurses, my wife told me that she's had several uh, procedures and been in the hospital. Her best care was by male nurses because she said they respected her as a patient.
Mhm.
And that's not to throw shade on female nurses, but for her and her experience and our comfort level, these gentlemen will come in, close the curtains, ask who's this sitting, the typical things. You don't just assume
Right.
because I think males, we're kind of guarded. We don't want to mess up. And it doesn't take but a little bit for we to do that would maybe not get said about a female nurse that gets said about a male nurse. So I have to protect my family, I have to protect my license, I have to protect myself
Yes.
and protect that patient as well. So I there's just a lot of things that keep me in it. Um, I'm not sure there are many other things I would want to do and get the satisfaction that I get. I've looked at other ventures. We've been in business. We've had businesses, and they were okay, and they had their place. But for me, this is the reward is this has done so much for my family and
Yes.
for me till uh, I'll always tell you that the nursing has value beyond compare. Um, you put a nurse up against a politician, and who will people believe? It's the truth. You can put a nurse up against a preacher, and I'm gonna be honest with you, people trust preachers.
Mhm.
They may trust nurses more, um, at least people that I know. So,
That's a good analogy. I appreciate you sharing that your experience is in your family with male nurses. We do know that there's a nursing shortage. and there's a shortage of male nurses. We know
Mm,
that we're in a pandemic, and we know that there's
absolutely.
a great, great, great need for more nurses. And so we
Mhm,
know that, the purpose of us really talking today is to really highlight that male nurses really matter. They
mhm,
matter in so many ways. The value that they add, the contributions that they continue to give,
mhm,
and it's just really important to know that you have a sense of satisfaction and that
mhm,
you can do what you love and get
mhm.
paid for it. I'm using your words now.
Absolutely. Absolutely.
You can do what you
Absolutely.
love and get paid for it. And so I
Mhm,
think that's a great segue. Now, I know recently you just joined with the Central Florida Black Nurses Association of Orlando,
mhm.
an organization that's been around since the early 80s. And so I think it was 1984 when they were established. Tell me, as a nurse, what are some of the things that you're looking for as part of being a part of that organization?
Mhm. First of all, let me just give a shout out to Black Nurses Association.
Yes.
So my first child was about to be born. I was a struggling tech. I put in for a scholarship from the Black Nurses Association. I was supposed to have an interview with Black Nurses Association. I could not meet them for the interview because my son Marquise was being born on July 16, 1987, and they approved the $500 scholarship for me without me physically showing up. So I give kudos to them, and this is like basically coming full circle.
Mhm.
Now, I'm not trying to make excuses, but it's sort of like the story in the Bible about Joseph. Um, the person that was able to get out and make a connection for him forgot about him until a particular time came, and then all of a sudden he remembered Joseph. This is sort of the Joseph story for me.
Mhm.
Joining the Black Nurses Association, they gave me a foot start, and I appreciate it. I thanked them at the time, but I especially thank them now. And what happens is, in our quest to learn how to do our job, we're not as closely associated with organizations per se. We're just trying to get the job done and go home. Recently, I also rejoined the Association of Operating Room Nurses as well. Now that in this stage of my life, I have a lot more flexibility, that I have time to now put more in. And I believe I have things that I can offer the Black Nurses Association in the male perspective. In that, as we promote for male nurses and promote for nursing in general, that our young people see us. So maybe we ought to make rounds to community centers and put on presentations and, you know, just like athletes do. Once they've reached a certain pinnacle in their game, they're a celebrity of sorts. They go out, young people say, wow, and so we pique their interests like that. Um, and I believe just listening, learning from the other professionals who are in the Central Florida Black Nurses Association, it helps me as a Black person to have an organization I can identify with. The challenges you talked about, all of us have faced those challenges to a degree. Not necessarily, they may not have been male, but there's prejudice, there's racism, there's things that we deal with. So when we come together, there's some tools we can bring to the table that can help in that instance. So I just appreciate the opportunity to be a part of such a great profession. As you know, our cousin is a part of this organization. So you're recruiting me, her being a part of it was really a natural fit for me.
Wonderful. Ivan, I certainly appreciate you taking time with me today to have a conversation about males in nursing matter, how they are really essential. I'm going to use essential workers. I'm going to use that because they're
Absolutely.
essential of what they bring, the value, how they contribute, how they really make a difference in the field of nursing. They have made a difference in so many ways. You have made a difference in so many ways. Being here, living in Central Florida, and then giving back
Mhm.
to the community by your services, by working in the healthcare profession for such a long time. I mean, honestly, it is very good to see a Black male nurse still in the profession, still
Mhm.
on the front lines, still
Absolutely.
serving our people, serving our community. I do want to thank you from the depths of my heart for sharing this, because this is information that we're not talking about. We're not
Right.
seeing the faces of Black male nurses in the forefront. And I
Mhm.
want to make sure that our audience knows that it is so very important to recognize not only nurses, not only female nurses, not only male nurses, but to recognize our Black African American nurses who are on the front lines, working,
Mhm.
caring, giving of themselves to move people from the sickness up into the health. Or not only that, helping them prevent sickness. So even
Right.
talking about preventive
Education.
medicine.
Mhm.
So this discussion is just the first of many that we will be having regarding why male nurses matter. Any final words, Ivan?
Well, I'd just like to thank you for this opportunity to share a little bit about what has happened through my journey. And it has been a journey, and it's not over. It's still going to continue. I spent many years doing volunteer service for youth and young people. And so I understand partially how they think. So, in working with the organizations that I worked with and the ones that I will be working with, I can use those tools to promote um, citizenship. But the main thing I think I want to share is in all our getting, don't forget God, remain humble, and trust Him where He leads you. And so, pretty much that's it.
So thank you. I want to end with that. Thank you. It says, trust in the Lord with all your heart.
That's right.
Lean not to your own understanding. In all your ways, acknowledge God, and
Hmm.
he will direct your path. So if you're indecisive of what you want to do in your profession, in your career, maybe you're looking for a career change, maybe consider what options are out there for nursing. There are many, 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 many options. And that's what makes nursing very special. I want to thank our audience again for joining us today. And most importantly, just remember, allow God to direct your path.